Okay, here's a pan of the room. My tools are over here. Nothing on the ground. Nothing over here. This is my video lady and my patient. Okay. Hi, my name is SLeMay. I'm a PA student at Nova Southeastern University, and I'm going to be performing a full body exam today. Okay?
You bet.
I'm going to start by washing my hands. The patient appears to be healthy and in no apparent distress. Usually for this exam, I would ask the patient to remove her clothes and I would give her a gown. Just for this purpose, or for this exam, I'm going to keep her with clothes on, and I'll auscultate around the clothes when I can, but I would never auscultate or palpate or percuss over clothing usually. Okay, I'm going to start with some questions. What is your name?
Mary Welch.
And what day of the week is it?
This is Saturday.
And where are we?
We're in Winter Garden, Florida.
The patient is alert and oriented ×3, and she has appropriate speech, dress, and behavior. I'm going to test your long-term memory. Who were our last 3 presidents?
That would be Trump, Obama, and Bush.
Okay. And then your short-term memory. Remember the words dog, cat, and house. Okay, and I'll ask you again in about 5 minutes. And then for the intellectual ability, count backwards from 100 by 7.
100, 93, 86.
Perfect. And now I'm moving on to the head exam. I'm starting by inspecting. I'm looking for any hair loss. The head is symmetrical. There are no deformities, and there is no hair loss. And now I'm looking at the face. Again, the face is symmetrical. There are no deformities or discolorations. And now I'm palpating the face. I'm palpating for any masses or tenderness. Is there any tenderness here?
No.
I'm over the frontal sinuses. And is there any tenderness here?
No.
There's no tenderness on the frontal or maxillary sinuses. The parotid glands are non-palpable. Open your mouth and close it, and then move it side to side like this. And then stick your jaw towards me. The TMJ is mobile. Is that tender at all?
No.
And non-tender. And now clench your jaw. And again. Great. Cranial nerve 5 is intact. Now raise your eyebrows. Close your eyes. Don't let me open them. Puff out your cheeks. Smile. Frown. Great. Cranial nerve 7 is intact. Now I'm moving on to the eye exam. I'm looking at the eyebrows, the eyelashes, and the eyes themselves. They are symmetrical. There are no deformities there. Now I'm looking at the conjunctiva and the sclera. Look up at me. There are no foreign bodies, icterus, injections, lesions, or edema there. And now I'm going to check the visual acuity with the Rosenbaum chart. Cover your left eye, and with your right eye, read the smallest line that you can read.
6, 2, 8, 3, 6, 5.
Perfect. And then with your left eye.
3, 2, 8, 3, 6, 5.
And then with both eyes.
The same line. 3, 2, 8, 3, 6, 5.
Perfect. OD, OS, and OU are all 20/40, and cranial nerve 2 is intact. Now I'm going to check cranial nerve 3, 4, and 6. So follow the pen with your eyes, but keep your face pointed towards me. Great. Cranial nerve 3, 4, and 6 are intact. There's no nystagmus or lid lag. And now follow the pen in with your eyes. Great. And then look at the pen and look at the wall behind me and back at the pen. Perfect. The eyes converge and accommodate to near vision. Now I'm going to check the visual fields. So while you're looking straight at me, tell me when you see my fingers wiggling in your side vision, okay? Ready?
Now.
Perfect. And again?
Now.
And again?
Now.
Perfect. And I'm checking crescent shadow, so look straight forwards at me. No crescent shadow is noted. And I'm checking for direct pupil response to light and indirect pupil response to light. The pupils are equal, round, reactive to light and accommodation, and they are about 3 millimeters. Okay, and now I'm moving on to the ophthalmic exam. I'm going to dim the lights. I have my dial set at 0. Go ahead and look straight ahead for me. The red reflex is noted. I've located the optic disc. The cup to disc ratio is 0.5. The margins are sharp without any lesions. The A to B ratio is 2 to 3. There is no nicking or spasming there. Look into the light for me. The macula is present without lesions, and there are no exudates or hemorrhages in the fundus. Same thing with this side. Look straight ahead at the wall. The red reflex is present. The optic disc is located. The cup to disc ratio is 0.5. The margins are sharp without lesions. The A to B ratio is 2 to 3, and there are no nicking or spasming. Look into the light for me. The macula is present without lesions, and the fundus is clear without exudates or hemorrhages. All right. Now I'm going to move on to the ear exam. I'm starting by just inspecting. I'm looking at the auricle, the tragus, and the mastoid processes for any deformities or discoloration. None of these are noted, and now I'm palpating. Let me know if you feel any tenderness, okay?
Mm-hmm.
Palpating the auricles, tragus, and mastoid process. Was that tender at all?
No, it wasn't.
No tenderness is noted here. Now I'm moving on to the otoscopic exam. This would be helpful.
Excuse me.
The tympanic membrane is located. It's a pearly gray and translucent. I see the pars tensa, pars flaccida, umbo, and the cone of light is in the anterior inferior quadrant. Swallow for me. And the tympanic membranes are mobile. Same thing on this side. The tympanic membrane is located. It's a pearly gray and translucent. I see the pars tensa, pars flaccida, umbo, and malleus, and the cone of light is in the inferior anterior quadrant. Swallow for me. And the tympanic membrane is mobile. All right. Now I'm going to perform the whisper test. So close your eyes for me. Tell me what you hear.
1, 2, 3.
Okay. And again.
4, 5, 6.
Okay. Cranial nerve 8 is intact. And now I will do the Weber test. I'm going to activate it and put it on the top of your head. Tell me where you hear it.
Both sides.
Perfect. The Weber is midline. And the Rhine test. Tell me when you stop hearing it, okay?
There.
Do you hear it?
Yes.
Perfect. And again on this side. Tell me when you stop hearing it.
Okay. There.
And do you hear it?
Yes.
Perfect. The AC is greater than BC. And now I'm going to move on to the nose exam. I'm starting by just inspecting the nose. It is midline. There are no deformities here. Occlude one nostril and breathe in for me. Perfect. And then the other one. Great. And now I'm going to check cranial nerve 1. Close your eyes. Occlude one nostril. Close one nostril. Good. And tell me what you smell.
Oh, flowers.
Perfect. And then the other one.
Citrus.
Perfect. Cranial nerve 1 is intact. Now I'm going to look inside of your nose. Tilt your head back for me. The mucosa is pink and moist. There are no obstructions, lesions, or masses. And same thing with this side. The mucosa is pink and moist. There are no lesions, masses, or drainage here. Perfect. Okay. And now I'm moving on to the mouth exam. I'm looking at the outer mouth and then open for me. In the inner mouth, again, the mucosa is pink and moist. There are no lesions or patches or nodules or anything like that. Not yet. And I'm checking the teeth. Ready? Tongue in your mouth. And close your mouth. Close and smile. The teeth are in good oral hygiene with good oral repair, and they are, was that tender at all?
No, it was not.
They are non-tender. And now open your mouth, stick your tongue out and say, ah.
Ah.
Good. Cranial nerve 10 is intact. The uvula rises midline upon phonation and does not deviate to either side. And then I would check the gag reflex, which is cranial nerve 9 and 10, but we're going to skip that. Now stick your tongue out and move it side to side. Cranial nerve 12 is intact and the tongue is midline. Now I'm going to put gloves on. I'm going to check your tongue, okay?
Mm-hmm.
Okay, stick it out for me. Okay. There are no nodules or lesions or patches on the tongue. And lastly, I'm going to perform a bimanual exam. Stick your tongue up. Perfect. There are no areas of induration, masses. Was that tender at all in your mouth?
No, it was not.
And no tenderness. What were those 3 words that I asked you to remember?
It was dog, cat, and house.
Perfect. Now I'm going to move on to the neck exam. Tilt your head back just a little bit. I've located the trachea. Swallow for me. The trachea is midline and it is mobile. I'm going to move on to the lymph nodes, the occipital lymph nodes, the postauricular, preauricular, the submandibular, the submental, the anterior cervical, the deep cervical, the posterior cervical chain, and the supraclavicular. There's no lymphadenopathy noted here. And now I'm going to auscultate the carotid arteries with the bell of my stethoscope. Take a big deep breath in and hold for me, okay? Perfect. And then you can breathe. And again. Okay. No carotid bruits are noted here, and they are round and full, and they are approximately during systole. And now I'm going to, from behind, I'm going to have you go this way just so, turn, perfect. And locate the thyroid. Look down to your right knee and to your left knee. So I'm displacing the thyroid, and all done. The thyroid is of normal size, shape, and consistency, and there are no nodules or masses there. And then I'm going to do the cranial nerve 3, so raise your, or cranial nerve 11, raise your shoulders, and then look this way. You can put your shoulders down. There you go. Look this way, and then this way. Good. Cranial nerve 11 is intact. And now I'm moving on to the respiratory exam. I'm going to start by inspecting the anterior and posterior chest wall. It is symmetrical and of appropriate contour, flat here and appropriately curved in the back. I'm looking at the fingers and the face for cyanosis. This is not noted. And now I'm moving to the back. I'm going to have you rotate this way, all the way this way, perfect. I'm starting by palpating. I'm palpating the posterior chest wall for any masses, crepitus. Is this tender at all?
No.
Or tenderness? None noted here. And now I'm going to check tactile fremitus. So say the words 99 for me.
99.
And again?
99.
Again?
99.
And one more time?
99.
Tactile fremitus is equal in all fields. And now I'm going to percuss in the 7 paired areas. No dullness with percussion there. And now I'm checking for CVA tenderness. Let me know if this is tender at all, okay? And again, any tenderness?
No.
No tenderness is noted here. And now I'm going to auscultate. Go ahead and take normal breaths for me, okay? I would never auscultate over the shirt. Okay. No adventitious breath sounds are noted here. And now I'm going to twist you again. Come back this way. I'm going to check the axillary lymph nodes. Putting gloves on. And rest your arm right on my shoulder like this. The anterior axillary lymph nodes. The medial axillary lymph nodes. The posterior axillary lymph nodes, and the lateral, and then the epitrochlear right here on the bicep, and again on this side, the anterior, the posterior, the central, the lateral, and epitrochlear. No lymphadenopathy is noted here. And now I'm going to move on to the anterior chest wall. So I'm going to start with palpation. I'm palpating again for any crepitus, masses, step-offs. Is there any tenderness here?
No.
And no tenderness is noted. Now I'm going to percuss in the 6 paired areas on the anterior chest wall. And then I would do 5 and 6 here under her breasts. And then I am going to check for tactile fremitus. So say 99.
99.
And again.
99.
And then I would do 99 under her breasts here. There was no dullness to percussion. And now I'm going to auscultate. Breathe normally for me, okay? With the diaphragm of my stethoscope. And then I would go ahead and go through 4, 5, and 6 under her breasts. There are no adventitious breath sounds noted here. And now for the special test, I'm going to perform a gophony. So you will say E and just hold it, okay? Perfect. Egophony is negative. If it were positive, it would sound like an A, and it does not. It sounds like a muffled E to me. Okay, and now I'm moving on to the cardiovascular exam. I'm going to start by listening with the diaphragm of my stethoscope. I am at the second intercostal space, right sternal border, listening to the aortic valve. The second intercostal space, left sternal border for the pulmonic. The third intercostal space, left sternal border for Erb's point. The fifth intercostal space, left sternal border for the tricuspid valve. And the fifth intercostal space, midclavicular line for the mitral valve. And back with the bell of my stethoscope. Again, the fifth intercostal space, midclavicular line for the mitral valve. The fifth intercostal space, left sternal border for the tricuspid valve. The third intercostal space, left sternal border for Erb's point. The second intercostal space, left sternal border for the pulmonic valve. And the second intercostal space, right sternal border for the aortic valve. And now I'm going to have you lean slightly forward, take a big deep breath in, and hold for me. I'm listening over Erb's point for the physiological split of S2 and S3. Go ahead and relax. That is present. And now we're going to move to the bed.
Okay.
You can lie down. Perfect. I'm going to start by palpating. I'm palpating over those 5 regions for any lifts, heaves, or thrills, and for the PMI. There are no lifts, heaves, and thrills, and the PMI is non-displaced. And I'm going to listen again. I'm at the second intercostal space, right sternal border, the aortic valve. Second intercostal space, left sternal border for the pulmonic. Third intercostal space, left sternal border at Erb's point. Fifth intercostal space, left sternal border at the tricuspid valve. And fifth intercostal space, midclavicular line for the mitral valve. And again with the SLeMay stethoscope, the fifth intercostal space, midclavicular line for the mitral valve. The fifth intercostal space, left sternal border for the tricuspid valve. The third intercostal space, left sternal border for Erb's point. The second intercostal space, left sternal border for pulmonic. And the second intercostal space, right sternal border for aortic. And now I'm going to have you roll onto your left side, so face that way, perfect. I'm listening at the mitral region with the SLeMay stethoscope for any S3 or S4 gallops. And these are not noted. There you go. The rate and rhythm are regular, and there are no murmurs, gallops, or rubs. And now I'm checking the peripheral vessels. I am looking for any clubbing, cyanosis, and I'm looking at the capillary refill. Perfect. And then at your feet. Again, I'm looking for cyanosis, clubbing, and the capillary refill. There is no cyanosis, clubbing, and the capillary refill is less than 2 seconds. And now I'm checking the pulses. I'm going to start with the brachial pulses. The radial pulses. The popliteal. The posterior tibial pulses. And the dorsipedi pulses. Okay, the pulses are all equal and symmetrical and 2+. Now I'm going to move on to the abdominal exam. So I'm going to remove these pillows from behind you. You can lie all the way back. I'm going to lift up your shirt. Perfect. So normally the patient would not be wearing clothes, so I would be able to see everything. I'm starting by inspecting. The abdomen is flat and it is symmetrical. There are no scars, striae, and there are no pulsations here. I'm going to auscultate. I'm in the right upper quadrant. The left upper quadrant. The left lower quadrant. Again, I would not auscultate over clothing. The right lower quadrant. The epigastric. the umbilical, and the hypogastric region. And I would make sure to do that for a full 2 minutes before declaring that bowel sounds are present, which I did hear bowel sounds. And now I'm going to listen to the abdominal vessels, the abdominal aorta, the renal arteries, the left, and then the right, the umbilical arteries, and again I would not listen over clothing, the left and then the right umbilical artery. There are no breweries noted here, they all are equal. And then I would also listen for the femoral arteries, and I would check the inguinal lymph nodes. Now I am going to percuss. I'm going to percuss over the 4 quadrants and 3 regions again. The right upper, the left upper, the left lower, the right lower, the epigastric, the umbilical, and hypogastric. I was percussing for tympany and dullness there. And now I'm going to percuss the liver. I'm going to percuss from the tympanic to the dull here, and then from resonant in the lungs down to dull in the liver. Right about there. And then that's good. And then down. Right about here. Okay. The liver is about 5 centimeters in the midclavicular line. And now I'm going to palpate. I'm going to start by palpating lightly in the right upper quadrant. I'm looking for any muscle rigidity, tenderness, masses. The left upper quadrant, the left lower quadrant, the right lower quadrant, the epigastric, the umbilical, and the hypogastric region. There's no muscle rigidity guarding. Was that tender at all?
No, it was not.
And no tenderness. And now I'm going to deeply palpate, so just a little deeper in the same quadrants and regions. Again, I'm looking for any muscle rigidity, any guarding, and is this tender at all? Any tenderness? Not noted. And now I'm going to palpate for the abdominal aorta, which is slightly left of the umbilicus. The abdominal aorta is about 2 centimeters, and it does not pulsate laterally. And now I'm going to palpate for the liver. No, that's good, just how you are.
Okay.
Breathe in for me, and out. The liver is non-palpable, and then roll over to your right side. So face me, perfect. And now I'm palpating for the spleen. Breathe in and out. The spleen is non-palpable. Were either of those tender, your liver or spleen?
No.
Neither were tender.
No.
Okay, at this point I will perform a rectal and genital exam. We are going to move on to the dermatomes. Okay, so stay how you are right there.
Okay.
I'm going to start, I have a dull and a sharp stimulus. I'm going to have you close your eyes. Okay, tell me if you feel dull or sharp, okay? In C4.
Sharp.
Good. C4.
Sharp.
Put your arms just like this. C5.
Sharp.
C5.
Sharp.
C6.
Sharp.
C6.
Sharp.
C6 again.
Sharp.
C6,
Sharp.
C7,
Sharp.
C7,
Sharp.
C8,
Dull.
C8,
Sharp.
again over here,
Dull.
C8, and again,
Sharp.
C8, and then T1,
Sharp.
T1,
Sharp.
T4 would be on the nipple line, T10 would be at the umbilical line, T1 would be on the hips right here, or excuse me, L1 is on the hips, L3,
Sharp.
L3,
Sharp.
L4,
Sharp.
L4,
Sharp.
L5,
Sharp.
L5,
Sharp.
S1,
Sharp.
S1,
Sharp.
L5,
Sharp.
L5,
Sharp.
L4,
Sharp.
L4,
Sharp.
and S1,
Sharp.
S1.
Sharp.
Okay, she is responsive to dull and sharp stimulus. And now I'm going to use a light stimulus. I'm going to start with your face. This is cranial nerve 5. I'm in the ophthalmic region. Tell me when you feel it.
Yeah.
And again, the ophthalmic region.
Yes.
The maxillary,
Yes.
maxillary,
Yes.
mandibular,
Yes.
and mandibular.
Yes.
C4,
Yes.
C4,
Yes.
C5,
Yes.
C5,
Yes.
C6,
Yes.
C6,
Yes.
C6,
Yes.
C6,
Yes.
C7,
Yes.
C7,
Yes.
C8,
Yes.
this side, C8,
Yes.
T1,
Yes.
T1,
Yes.
and then I would do T4 on the nipple line, T10 on the umbilical, L1 on the hips, L3,
Yes.
L3,
Yes.
L4,
Yes.
L4,
Yes.
L5,
Yes.
L5,
Yes.
S1,
Yes.
S1,
Yes.
L5,
Yes.
L5,
Yes.
L4,
Yes.
L4,
Yes.
S1,
Yes.
S1.
Yes.
Okay, she is responsive to light stimulus in all of the dermatome areas, and cranial nerve 5 is intact. Now I'm going to test the vibratory sense. So I'm going to activate this and tell me what you feel, okay? Close your eyes for me.
Yes.
You feel vibration?
Yes.
Excellent. Same thing on this side.
Yes.
And again.
Yes.
Last one.
Yes.
Okay. And then keep your eyes closed and tell me what you feel.
Tablespoon.
Okay, so she is able to recognize this through stereognosis. And I'm going to, this is down, bent, this is up. Keep your eyes closed and tell me which direction your thumb is facing, okay?
Up.
Good. And then this one?
Bent.
Good. And your toe?
Straight up.
Good. And again?
Bent.
So she is able to recognize her fingers and toes through proprioception. Okay. And now I'm going to have you come up. We're going to move to the upper extremities. You can sit right here for me.
Okay.
I'm going to start by inspecting. I'm looking at the shoulders, elbows, wrists, and hands. I'm looking for any deformities, which I do not see. They are aligned and symmetrical. Now I'm palpating the SC joint, the clavicle, the AC joint, the scapula, the deltoid, the bicipital groove, the triceps, the biceps, the olecranon process, the medial and lateral epicondyles, the extensors of the forearm, the flexors of the forearm, the carpals, the metacarpals, the MCP joints, the PIP joints, the DIP joints, the thenar muscles and the hypothenar muscles, There is no swelling, heat, or tenderness noted here. And now I'm going to go through the ranges of motion, okay? We're going to start with your shoulders. We're going to flex, extend, adduct, abduct, externally rotate behind your head, internally rotate. The shoulders are within full range of motion. Then we're going to flex our elbows, extend, supinate, pronate, not supinate again. Great, the elbows are within full range of motion. In the wrists, we're going to extend, flex, and then with your hands up like this, radially deviate, perfect. And then ulnar deviation with your fingers, abduct, adduct, flex, flex your thumb, extend your thumb, adduct your thumb, abduct your thumb. Good. And then finger or thumb to all fingers like this. Great. So the shoulders, elbows, wrists, and hands are all within full range of motion. And now I'm going to check the manual muscle strength. So stick your arms out just like this and push against my hands. So this would be flexion and then push down, extension, and then arms out like this, and then push towards my hands. So it'd be abduction, and then other way, push towards my hands, adduction, and then up like this, make a muscle, push against my hand, external rotation, push back towards towards the bed.
Oh,
There we go.
okay.
External rotation, and then towards the wall. Internal rotation, same thing with this side. Push back towards the bed, external rotation, and then towards the wall. Internal rotation, and then with your elbows, push up against my arm, perfect, and then down. So that would be flexion and extension of the elbow, and then up against my arm, good, and back down. So flexion and extension of the elbow, and then hold my hand, flip your hand over. This is supination and push it back, pronation, and same thing, flip it over, supination, and then back, pronation, perfect. And push your hand against mine at the wrist like that, perfect. Again, perfect, and then flip your arm over. So that would be extension of the wrist, and then push against, and then flexion of the wrist. Same thing on this side, extension of the wrist, flip it over, flexion of the wrist, and then your fingers like this, don't let me push them together. So this would be abduction, and then don't let me push them apart. This is adduction. Grab my fingers with your fists. Good. So that's flexion of the hands, let go, and then make fingers like this. Don't let me pull them apart. Great. So the manual muscle strength is 5/5. And now we're going to move on to the lower extremities. You can lie down over here.
On the back.
Yep, on your back. Watch out, buddy. Move over. So I'm starting with inspection. I'm looking at the hips, knees, ankles, and toes. I'm checking for symmetry and alignment and deformities. They are symmetrical and aligned, and there are no deformities. I'm palpating the iliac crests, the femoral tuberosities, the greater trochanter of the femur, the quadriceps muscles, the vastus lateralis, the vastus medialis, the rectus femoris, the suprapatellar pouches, the medial and lateral condyles, the tibial plateaus, the patellar tendon, the tibial tuberosity, the popliteal fossa, the femur medial and lateral epicondyles, the gastrocnemius, the tibialis anterior, the Achilles tendon, the medial and lateral malleoluses, and the feet, the MTP joint and the IP joints. There's no swelling, heat, and was any of that tender to you?
No.
And no tenderness. Now bring your knee to your chest. So this is flexion of the knee and hip, internal rotation, external rotation. Same thing with this leg, flexion of the knee and hip, internal rotation, external rotation. And then kick me with this foot. Bring it out, kick me in my knee. There we go. So that would be abduction, and then cross your foot over. Cross this foot over. Great. And that's adduction. So same thing on this side. Kick my hand. Move it out to the side. Perfect. Abduction and then cross it over. Adduction with a D. And now come back and sit right here for me.
Okay.
Now I'm going to have you make circles with your ankles, both of them. Perfect. So I'm looking at dorsiflexion, plantar flexion, move them around like this, just at the ankle joints. Perfect. And then inversion and eversion. The hips and knees were within full range of motion, and the ankles are within full range of motion, active motion. Now passive motion, I'm checking the tiliotalar, so I'm going to flex, do dorsiflex and plantar flex, the subtalar, eversion and inversion, and the transverse tarsal. Good. And then on this side, the tiliotalar, the plantar flex, dorsiflex, the subtalar, inversion and eversion, and the transverse talar here. Her ankles are within full range of passive motion. And now we're going to move back to the bed on your stomach now. I'm going to check hip extension. So lift this leg up in the air. Keep it straight. Perfect. So this is extension of the hip. Don't let me put it down.
Oh, sorry.
That's okay. Same thing with this side. Up. And don't let me push it down. Good. So this would be extension of the hip, which is in full range of motion. And then this was the manual muscle strength. We're going to finish manual muscle strength over here. Come back and sit down for me. Push your leg up against my hand. Good. This side. Good. Push your legs apart and together. Great. And then kick your ankle into my hand. Good. Kick it out into my hand. So this would be external rotation. Now is internal rotation. Same thing over here. Into my hand. Internal. External rotation. The hips are within full range of motion. And now kick me with your feet. Great. And then back in. Perfect. So that would be extension of the knee, flexion of the knee. Push your hands up into, or push your feet up into my hands at your ankles, toes to the sky. There you go. And then down. Perfect. So that was flexion of, or dorsiflexion of the foot and plantar flexion of the foot. And then lift your big toes up. Good. Flexion of the big toe. So the manual muscle strength is 5/5. And again, the hips, knees, ankles were all within full range of motion. Now I'm going to check for clonus. So relax your feet completely. Okay. No clonus is noted here. And I'm going to move on to the reflexes. I'm going to start with the triceps reflex. And on this side, let your arm dangle. Good. The biceps reflex. Just let it dangle for me. Good, perfect. And again on this side, the biceps reflex. Good. The brachioradial, so let your hand just dangle. And again on this side. The patellar, let your legs dangle down. And this side. Good. And the Achilles. And again, the Achilles. Good. The reflexes are all full and symmetrical and 2+. Now we're going to do the rapid alternating movement. So on your thighs, go like this with your hands. Great. And then same thing, tap your feet into my hands as fast as you can. Great. And then with your right hand, go from your nose to my finger, okay? I'm going to move my hand. Perfect. Keep going back and forth. Back. And now close your eyes and back to my finger. Back to your nose. Perfect. And then switch hands. Same thing with your other hand. And then close your eyes. And back. Perfect. Great. And now we're going to check your gait. So go ahead, stand up for me. Walk to the dresser and back with your normal walk. And back on your tiptoes. I'm looking for muscle coordination and balance. And then back on the heels of your feet. And then back heel to toe like this. Good. And then we're going to move on to the Romberg equilibrium. So I'm going to have you step forward just a little bit. I'm standing behind her. Have your toes and your feet together, moving together. And then close your eyes, okay? I'm going to count to 30. Okay, you can open your eyes. And then stick your hands straight out in front of you. And close your eyes. And I would wait about 20 to 30 seconds. There's no pronate or drift noted here. You can open your eyes. And now I'm going to turn this way. I'm going to move on to the vertebral exam. I'm inspecting, I'm looking at the cervical, the thoracic and lumbar spine. It is symmetrical and aligned. Now I'm palpating. Let me know if you feel any tenderness, okay?
Mm-hmm.
I'm palpating the cervical spine, the thoracic, and the lumbar spine. No swelling here or tenderness. Is there any tenderness?
No.
No swelling here or tenderness was noted there. And now we're going to go through the ranges of motion. We're going to start with the neck. Look at the ceiling. So this is the cervical spine. And then chin to your chest. Look to your right and to your left. And then put your right ear on your right shoulder, like this. And then your left ear on your left shoulder. The cervical spine is within full range of motion. And then go this way for me, twist. Touch your toes. And then back up, lean backwards with your shoulders. Good. Turn to your, stand straight up. And then turn to your right and to your left. And then with your left arm, slide it down your left thigh. Perfect. And then with your right arm down your right thigh. Great. And the thoracic and lumbar vertebrae are within full range of motion. And that would be the end of my exam.